Welcome to the Too Posh Podcast.
I am Gabrielle. I am a former New York Mafia princess, originally from Austria. I am the mother of 3 and the owner of Too Posh Boutique, and here with my beautiful co-host, Marcella, my daughter.
Hello, I'm Marcella. I'm a dancer, choreographer, model, and designer for Too Posh, and I say whatever the I want.
Hi, my name is Cruz. I am a stylist. I also own the Society Salon in the Design District, and I am a short little Mexican with a big personality.
I am Polly. I am a certified sexual health consultant and educator, former professional dominatrix, currently working at the largest adult novelty store in the Texas Panhandle.
What will they say next? Welcome to the Too Posh Podcast.
Welcome to our Too Posh Podcast. I am Gabrielle. I am here with my daughter, Marcella.
Hello.
And our Cruz.
What up, what up?
And Spider, thank you.
Oh, that was the wrong one. Hey.
And we have 2 special guests on today. We have Stephanie Fallman and Theresa Reynolds.
Yes,
Reynolds. And they are both from Lemmon Avenue Plastic Surgery.
Yes. We
Big
love
fans,
it there.
Big fans.
Yeah.
It's my favorite place to
Yeah.
go.
Well,
Ours too.
I feel like one of us is always there.
I know.
And we're going to start the show with Stephanie. Stephanie is a microneedling and skincare expert. And I have recently started doing microneedling with Stephanie. She's so lucky to be here. No, I'm kidding.
She was hurting last time.
But we're going to talk about all that.
Yeah.
But I wanted for Stephanie to have an opportunity to introduce yourself and tell us how you got into this field and talk about your passion, because I feel like there's so much passion within you to doing what you're doing, and it's appreciated, and I want everyone to know how you got here and why you're doing what you're doing.
Thank you. I actually started when I was a teenager. I had really, really bad acne. And it was just about finding all the things. My mom took me to a dermatologist when I was 10, and he was like, oh, let's get you on some Retin-A. And, you know, all the things that come with that, the flaking, the dryness, the, you know, sun sensitivity. And so then it was like, well, you know, let's find a sunscreen that doesn't break you out. And just it all tumbled into a journey of, you know, then it became makeup was really big to cover up my skin and cover up the acne scars that were left. And after a while, actually what happened is my car got broken into and all my makeup got stolen.
Oh my
No
gosh.
way.
And
How old were you then? When was this?
That was about 10 years ago. And all of a sudden, like, as I was waiting for the insurance company to cut me the check, which the amount offended my father on how much I had spent on makeup to cover my skin. He was just like, why don't you do something to make your skin better? And the thought kind of blew my mind. And I was like, oh, yeah, you're probably right. And so it started this skincare journey, because I didn't have the money to like go out and buy like makeup. I just started researching what would help my acne scars, what would change like just my skin, you know, take it from being oily and then sometimes dry and just frequently breaking out, like what would make my skin healthy and happy, and then what could I do to fix the scars. And I came across this I was watching YouTube and they were talking about, it was when the derma roller became really big.
Yeah.
And then I came across what was the Dr. Pen, the skin pen. And then I was
How
like,
long ago was this?
that was about 5-6 years ago. And I saw microneedling, and then that was like, I think a year or 2 after that, like Kim Kardashian did the vampire facial, and that blew my mind. And I looked into that, and it was just, I was a nurse, you know, on a normal nurse budget.
I was just going to ask, where did you work at that time? What were you doing?
I worked at Parkland Hospital
As
an ER nurse.
That always blows my mind. That is a job I can't even imagine.
It was a job. It was a wonderful, wonderful job. And, you know, that also, you got to see a lot of skin conditions. You get to really be involved in the patient's care, and you learn a lot of knowledge and you get to see everything and you get to talk to a lot of people. And so using all of that, it was really funny. I had like a very simple-ish 7-step skincare routine, and I would be running late.
A simple 7 steps.
Teresa, she's like,
That's wild. Yeah.
But I worked nights, and I would be running late constantly. So I would wash my face, and I would like put something on in the car. I would put my toner on, and then I would run to the hospital. I would get my report, and I would go see all my patients. And I would give a few meds, and then I'd sit down, and I'd take out my skincare bag, and I would start putting on these layers. And people were just like, the other nurses were like, "What are you doing? Like, you're crazy." And they'd be like, "What do you have in that bag?" And then a few people were like, "Oh my gosh, you have really good skin. Let me see." And then it evolved into, "Hey, can you do that to my face?"
oh, wow.
And then it would be, especially if we were in the back nurses station, it would be me and 5 other nurses, and we'd all line up in a row, and I'd be like, "Okay, we're gonna do the first step, everybody." And I'd wait, and I'd actually bring my cleanser, and we'd get washcloths from the laundry, and we would go all the way through our skincare. And then I got a Dr. Pen, the skin pen, for myself. And then I had a few nurse friends, and they would come over on a Saturday morning after we worked Friday night, and we would go through, and I would microneedle everybody's faces, and
Oh my God. That is unbelievable.
just using serums and stuff. And then I really saw like a lot of my friends that had acne scars just like I did, like our skin was getting better and better and better. And at this point, like I had my entire bathroom was skincare, just crazy amounts of like 5, 6 of every kind. And so then I met Jen, and Jen was kind of like, at one point she was just like, "Hey, I need an assistant. Do you want to come, on your days off and work part-time with me?" And I was like, And so I was working part-time with her, and then she was like, "Hey, you know what? You're really good at this. You should start microneedling clients." And so I did. And that's how I met you.
That's how she was like, "You need to see Stephanie." And I was like, "Okay, whatever you say." I listen to whatever you say. So first of all, our listeners that are listening, they need to go on YouTube when this comes out and look at both these ladies' skin. It is unbelievable. Like that, it seems that you say that you had acne scars seems
horrible acne scars.
Absolutely unbelievable to me.
Truly.
Because there's not even a pore.
No,
I know.
Glass.
Yeah.
It's unbelievable. So like I said, I listen to whatever Jen tells me to do. So I was like, all right, I go do that. And then I'm scared of needles, like
Same.
crazy. I got used to the Botox. I don't need what cruises. But I am more nervous when I have to get my blood drawn because I don't have really good veins. I had meningitis when I was young, and it was a very traumatic experience. So I'm like, you can't take my blood. I can't do it. And this girl, it's just something I can't explain. Like her bedside manner, the way she talks to you, she makes me believe I have the best veins in the world. Which I don't even know.
Do have good veins.
And she gets it always on the first time. And then we did the first one, and it was, it's not the most comfortable thing to do, but it wasn't too bad. And then I basically, going to Jen and to Stephanie, and then getting to an age where people are starting to say, well, you have to have a facelift at some point. Like, you can't keep doing these things. I don't know what happened to me one night. I was like, what if I just go to everyone at Lemmon Avenue and have them try for me to drag out and not have a facelift?
That's the goal of Lemmon
That's
Avenue.
the goal.
Yeah.
And so
Don't tell Dr. Dewar, though.
No, we want to, I think he's on board with that, though.
eventually,
Yeah.
obviously, but I then asked her, I said, can I be like that person? Like, try it on me. I'll try whatever you want me to do, and I'll see, and then maybe I can be basically an advocate for other older people and older women, and then we can stretch it out a little bit. I mean, surgery is scary.
Definitely.
You know?
It is.
So, and I know I see this all the time when you get older. Well, yeah, your face changes as you get older. So, yes, but it's still a bigger change, I think, with surgery. I mean, I don't know. But
It
that's where I'm
definitely
at.
is. Well, and
so,
then you've got to worry about like anesthesia and healing
Right.
time and
right.
downtime and turnaround from it. And are you going to be happy afterward?
Side
So-
effects, whatever.
Oh, for
so
sure.
I'm not saying I won't ever do it, but I want to just do everything to not do it yet,
Yeah.
basically.
Well, you
That's
want
what
to do
I'm
it
doing.
in your time.
Right.
You know?
So then I went back to Stephanie this last time. Wait, this was my third time with you?
Yep.
That was my third time. So she says, I had like, all these things happen, so I couldn't like get to my other appointment, but I have to do it 3 times, 6 weeks apart. Then I have to throw in some lasers and whatever else not that I have to do. Now, she's taking what I said very serious because this last time I was like trying to hit her.
She
No.
did. She did. She
So-
kept going. I was like, no, you can do it.
She's like, you can do it. Now I brought something to show you. You have to have this.
Oh my
Yes.
God, you brought your Pronox tubing.
She
That's
made
my
this.
favorite right there.
Oh, it's
But
everything.
she doesn't know how to
Still
do
don't
it.
know how to use it. I swear to God, there's no way I did it right.
You just
I have no
suck it
Do you
idea.
in.
have this in your bag?
She made me take it home with me.
Oh!
because now
to
I
bring
have
it
to
each
practice.
time.
You have to
gotta
bring it
it
each time.
I have to bring it. I just wanted to show
You connect
our
one to the
people.
nitrous and one to the oxygen.
I wanted to show the people what you have to do with this. I did whatever the rinsed it, whatever it's
You
whatever
watched
it is.
it. You watched
yes,
it.
whatever you're
Move
supposed
your
to do.
iPad.
She's from Europe, just in case.
So-
English is hard sometimes.
Anyways, I'm supposed to use this. It's supposed to help me. I don't know what I'm doing. I don't think I breathe the whole time. I'm holding my breath.
That's the problem.
And that's the problem.
Yes,
So I'm
yes.
like, I want that thing in my nose. Then Stephanie goes, no, you can't have that because then we have to have an extra person. And I'm like,
Yeah.
can I pay this extra person?
That's the best part. That's the best part.
But if you don't even know what you're doing,
You just
it's a
inhale
problem.
it.
It's like she never smoked a cigarette.
That's what it is.
I used to.
But did you smoke cigarettes
Yeah,
or
cigarettes.
did
Yeah,
you?
she was a
No,
cigarette
just cigarettes.
Okay. Okay. Well, that's the difference. If you're
Okay.
smoking a cigarette, you take it into your lungs and you let it go really easily. You can think about it that way. But I think it's easier for my patients, at least, if I say, well, have you ever smoked weed before? And then they say, yeah. And then I go, just smoke it.
Just
and
never
so
smoked
you
weed.
just
I've
Hold
never
it
done
in.
that.
yeah, so
Hold it
that
in.
analogy works for a lot of people when I have to have them, but it wouldn't work for you. The key is to just breathe in real deep. You feel it vibrate in your hand.
Yep.
As long as it vibrates every time you breathe, you're getting it. If
I
it
don't
doesn't
think it ever vibrated.
Yeah, so you weren't getting the full capacity, so to speak. But
Does it
didn't-
make
I
you
didn't know
dizzy?
that.
What does it make you feel like? You're just
No,
calm.
you're just in the corner somewhere
Makes you feel
far away from
chill.
Stephanie.
Oh,
Like,
no,
you just
I
don't
was
get
right
it.
there.
You were right there. Yeah. You didn't get it then, honey.
I knew I didn't get it because I know what it's like when I have the dentist.
Yes.
I like this very much, and this
I
doesn't
like
work.
this very much.
Everyone loves it.
So, anyways, there is that, and I was like, I don't know. I need some pain management. So I think next time I'm going to take an entire Xanax.
Yep.
And have
then
someone
you'll
drive
chill
me.
out
That
and
stuff
won't
works
care.
great though. That
You just have
nitrous
to use
just
it.
yeah.
Yeah.
She just wasn't breathing deeply enough.
You
You know,
want to
she's-
feel like you're like trying to take it
Yeah.
into your stomach.
I'm there
you
for like
want-
10 minutes sucking it before they
before
put
they
the
even
Botox.
start.
So, yeah.
Oh, same.
Oh, you do?
Oh
When
yeah.
Stephanie
See, I-
touches my face, I'm like, hold on, give me 10 minutes by myself. Let me get ready.
Wow.
And
Even
then
for
she
Botox.
comes
You
in.
do that?
For my Botox, I don't because I work there and everybody's like, you're absolutely ridiculous.
I
Right.
do.
But if I have to get like an injection or I tried a microneedling with Stephanie recently just to see kind of what it would do so I can better describe it to patients. No, in the beginning, I was like, you're going to get away from me because this is terrifying. And then I finally, she was like, just keep breathing. You know how to do this. And then I didn't care. Like I was floating somewhere and she was doing whatever she was doing.
Yeah.
yeah.
But until you get to that point, it's
Wow.
terrible.
Floating. Okay, that's my
yeah,
goal
that's
now.
the goal. That's to be floating somewhere else and your skin is getting treated by stuff.
Wow.
And then what do you want done? Everything.
Everything. Just do it while I don't know what's going on, okay?
Fuck me up. Fuck this.
Yes.
Now I do say
Exactly.
do everything, but we couldn't get through everything this time. because I couldn't do it anymore.
Next time.
So that's pretty intense, huh?
It's.
So-
I told. She's like, Cruz wants to do it. I'm like, let me see.
Yeah, I had an appointment, but I think I had to go out of town or something, and then we rescheduled it. So I know it's coming up soon. I don't know when, but I know it's coming up.
That's
Stella
okay.
is going.
I am
Mm-hmm.
in 2 weeks. Not this Tuesday, the next Tuesday.
I'm excited.
Me
She's
too.
excited.
I'm excited.
Scared.
I'm not scared at all.
I'm scared.
I'm so excited. I'll
She's
do all
excited.
the things.
You'll love it.
She is more. She said she's more afraid of. She's claustrophobic.
Oh yeah, I
So,
get claustrophobic.
That's what scares her more than anything.
No, that's not the microneedle. It's more the threads. It makes me feel
Ugh.
like my head is like stuck for some reason.
Ugh.
Oh, because it definitely is, because the pressure they've got to put on your face to get you to stay still. Yeah, I know what
Right.
you're talking about. Yeah, you feel like
That's
you're.
just what
yeah,
it
Stephanie's
looks
like, I
like.
know.
Oh,
But I
those-
think it's more. You shouldn't. I get the educational purposes of posting it everywhere, but I think it looks more traumatic than maybe it is.
It is.
Because it looks terrifying. You're
does.
like,
It does. It
looks
looks like it hurts.
Barbaric.
barbaric.
But it doesn't hurt.
Okay.
But
It-
that's
it's-
why I think it's smart. That's why even on my end of things, like I post all the gory, horrible looking things because I'd rather you be prepared for
Prepared.
the absolute worst and then come in and go, oh my gosh, that was so easy.
Yeah, for sure.
Rather than come in and go, oh, I had no idea this was going to be terrible. You know?
Yeah.
So like threads, I mean, yeah, they're going through tissue. You're going to, like with Botox, you feel crunching on your forehead
Oh,
when
yeah.
the Botox goes in. The thread is the same.
Yeah.
But Stephanie's so gentle when she does it. And
No,
she uses
she
a
is the
cannula,
best.
so it's,
She has
it's
the
really easy.
best bedside manner.
So
Yes.
This is
can you explain a
unbelievable.
little bit what microneedling is?
Yes.
Yes.
So microneedling is a pen tool, and it comes with a little head, and it has 12 needles, 12 hair-like needles. So they're very, very thin. It doesn't even really matter how long the needle is, but they're also short. And you adjust the length that the needles will come out, and when you turn it on, they go up and down so fast, it's literally a blur. Like your eye just thinks the needles are standing straight, but they're not. And so what we do is we roll it over the skin softly, just like at the very surface. And again, we can control the depth with the dial on the side. And it's important to be able to control the depth because the depth that you go in at your forehead is not the same depth that you want to go in on your cheeks. Because here we can't, if we just go in at a half millimeter or 1 millimeter, that's not going to be deep enough to get to the bottom of the scars, or also because this is a thicker area of your skin, it's not going to generate as much collagen. Whereas on the forehead, if I went at a 2 or a 2.5, you would think I was like going into your skull.
So thin.
So
I
yeah.
guess, yeah.
So this is thinner, and we just don't have as much padding here. So you want to be able to adjust it. But the reason why we want the needles to go into the surface of the skin, into the epidermis, is to create microtrauma, because then your body rushes to heal it, and it produces all this collagen and elastin, just like as if you got like a cut and you had a scar. That's remodeled tissue, that's full of collagen and elastin. And people studied that and they went, well, that's really strong, and it's smooth, shiny most of the time. And so how do we get that all over the face in a very even texture? And whoever came up with this is an absolute genius. But truly, you make the microtrauma and your body rushes to heal it, and it creates this beautiful, essentially what's scar tissue on the surface of the skin. And that's how we get that beautiful texture. It helps with your sebaceous glands. When we do it into the hair, it remodels the hair follicles so that they behave and start growing hair again, and going through hair cycle. I mean, it's wonderful.
Wow. So it also creates regrowth on new hair?
Mm-hmm.
Of a
So for
follicle that
men?
is still present.
Or
Not if you're
follicles
bald.
that are still present.
If you're bald, we can't bring back.
That's
no,
why
we
she
can't.
goes
From the
all way
day.
up. She goes all the way up here, like,
Mhm. But
and
if you've
then
got
you
thinning
grow
hair, it
new
helps.
hair.
Is there any cons to this?
There are a few. If you are very, very sensitive to hyperpigmentation, I do go a little bit lighter, or a little bit more carefully, or we also have medical grade skincare that will then help take any hyperpigmentation out of your skin.
What is hypopigmentation? What is that?
It's where
So hyperpigmentation with an ER is darkening of the skin is really the best way to put it. Hypopigmentation with an O is going to be the opposite of that. So if you think about, especially on Stephanie and I, on our skin tone, if I didn't have makeup on, I do have some hyperpigmentation on the lower part of my face. It just looks darker than anywhere else. So sometimes when you get scars and they kind of pigment a little more, that's your melanocytes that have sent tyrannase, is what it's called, to the surface of the skin. And so it's a little darker than the rest of your skin. And that can be a side effect with anything that you're doing to the face. Microneedling being one of the things that the risk is a little higher for on darker skin sometimes. That there are a lot of factors that play into that, but it's typically because, like she said, she's treating the epidermis, which is the top layer of the skin. Your melanocytes lie within your epidermis. So if you anger them, obviously they're going to do something. And usually on our skin tone, that's going to be making the area significantly darker than the rest of our skin.
But you can still do it?
Yes.
Mhm.
Yes. You have to qualify a patient for anything, right? So somebody could walk through the door and say, I want Botox. They get asked 5 questions by their injector, and then it turns out they can't get it. It could be a number of reasons why they can't get Botox. But
be
that's why you're,
devastating.
Same. I don't know
That
what
is
I
a
do. But that's why your consultation is going to be really important, because there are specific questions that we ask. There are markers that we look for within the answers that you give us. We assess all of your skin. I'm looking at arms, hands, ankles, whatever is available for me to glance at during a consultation to see how patient's pigment tells me what I can do on them. So sometimes, a patient won't be a candidate for microneedling. And so Stephanie will either pass them off for laser, or they may not be a candidate for anything, other than medical grade skincare. And that's still a really great option. There are just particular patients for each treatment.
Wow.
Wow.
So I have a question. What if somebody's like always out on the beach in the sun and they get, this microneedling on their face? Does it cause, do you have to do something different with that?
No, just wear your sunscreen.
Just wear sunscreen.
Wear your
nothing,
sunscreen,
Nothing different.
yeah.
It doesn't like take out, like your first layer of
Mm-mm.
skin or whatever. And
No, as long as you give your skin time to heal after your treatment. So let's say it's been a week, 2 weeks. No, you can go out and live your normal life. We do hope that you wear sunscreen
Every day.
Can you
Every
do
day.
microneedling over a beard? How does
Yes.
that work?
Yes. I generally lengthen the needles just a little bit to to compensate for the fact that there's more cushion.
So you do
Oh,
lengthen
wow.
these things how you feel fit. I knew it.
You did say you wanted to be a little bit more serious.
And then do you the blood that's everywhere, is that coming from the skin or that's from you drawing the blood?
The red part of the blood is actually coming from your skin.
Oh my gosh.
Yeah.
That's crazy.
Oh.
But so what it is you think about it, it's like if you have a lot of, let's say you have water, right?
Okay.
And you drop 1 drop of red dye food coloring in there, it turns it pretty consistently red or pink, right? So you have to remember, with the Glide that I'm using, it's pretty clear, slightly yellow. But all it takes is just a little bit of blood, and then all of a sudden all of it looks red.
Right.
Because I'm using that Glide all over your face. If I were to microneedle your face dry, which we would never do that. That would be terrible. That would just be terrible. It wouldn't look as red. It wouldn't look as red or as bloody, but it's just because I'm
I see.
literally spreading the blood and I'm mixing it with the Glide. And so it turns all of the Glide red instead of just a little bit that's actually coming out of your skin.
I see. That makes sense.
But yeah, so that's why it looks so much worse than it really is. And then, people think, oh my gosh, is that really painful even afterwards? And you're like, no. You're like,
I mean,
pulsates.
afterwards, like I always tell her, I put the air condition on my face full blast. That helps the most.
Yes.
This time, it was like 20 freaking degrees outside.
She's
So
hanging her
I
head out the
didn't
window.
So I have my seat heater on and my air conditioning on my face. But then by the time you get home, like the after thing is really, except that you look crazy and swollen and bruised. Like and there's still a tiny little bit of bruising there, but
My stepdad is always like, what the fuck happened to you? Do I need to kill somebody? Because she looks like somebody like mugged her in like an alley.
And there's also more aggressive types, right? There's like
there's no more aggressive than
weren't
her.
you talking about the vampire facial
Oh yeah,
too?
that's
That's what this is.
Oh, that's what it is.
That's what
So
Okay.
there's
Yeah.
a slight difference that I do want to point out. So when Kim Kardashian came out and did the vampire facial, she used PRP. PRP is very different from PRF, which is what Stephanie uses.
Oh, What
Okay,
is
so
it?
that's what
Tell us.
I've done.
PRP.
PRP.
So what are
Now,
the differences?
PRP is platelet-rich plasma, and PRF is platelet-rich fibrin. There's a difference in the centrifuge used or the settings on the centrifuge. So PRF is a highly concentrated version of your blood draw or of the product of your blood draw, whereas PRP, which I used for many years before, actually has more RBCs or red blood cells in it. So if I were to do anything and then put a PRP on top of you, that is in fact redness from what I drew out and spun out. So when Kim Kardashian posted all those pictures, that was red blood cells within her PRP on her skin.
Yeah, because that looked crazy.
Yes, that's totally different. So we are lucky enough to have PRF, which I prefer. PRP stings more. I used to inject it for hair loss, and patients literally would come off the table. It was so painful, even with a block. So with PRF, though, it's much more tolerable. I'm not going to sit here and say something's painless, but it's definitely
Tolerable.
not.
No.
Yeah, that's my favorite
They're not
word.
flying off.
So is it like that's the new version or?
You know, I think PRF has been around as long as PRP. I think that people just started to realize that getting a more concentrated count of the platelets or of the product of the spin was better for what you're doing topically, or well, if you're injecting it really. Topically, I would say PRP is fine. If you're just putting it on top of the skin. But if you're going to inject it, and Stephanie definitely injects the remaining amount into your face, I would much rather have a higher concentrated.
And when you
formula.
inject it, you're doing it with those little.
No, so when I
needles,
inject
or-
it, I actually use a cannula and place it wherever we want it, either in the hairline, under the eyes to really tighten this under eye area and brighten it.
What?
Yeah.
That's
Yeah,
so
I opted out of that
amazing.
part. So I'm going to be
I-
very honest with everybody.
You what?
I opted out of that part. She injected it on like the side, like kind
the
of like where
sides.
my cheek is, and I was fine with that. But I was like, "You are not sticking that thing under my eyes." I
Which
just
It's funny because it is
no.
it
That's
is
okay. I love you.
basically
gonna
painless.
be-
Oh, I'll do it under my eyes.
Yeah,
That-
and I think
that
anyone else
actually
would
is
do
not
fine.
That pain. That is actually just feels weird.
It-
Yeah.
it feels weird, but
I
it is
think
the
for me, it's
least
mental.
painful thing I do.
mental.
And
It's
then
like
the
you have
little-
a cannula under my eye. What?
Yeah,
Well,
it's
the
weird.
first time Jen came at me with the Botox under my eye,
yeah.
I was like, "What?" She was like, "You'll be fine. You'll like it." I was like, "Okay."
Oh, that's her favorite
Why
line.
do
You'll
I
be
like
fine.
it?
I
You'll be
was
fine,
like,
really? I'll be
"Holy
fine.
shit,
Thanks.
that needle's right under my eyeball."
Yeah.
But
And then you love it, and then
Yeah,
you're like,
of
"Okay, do that
course.
thing again that hurt me really bad."
Yeah, exactly.
I'll just
Exactly.
take it.
And then the different threads. The
Yes.
like what
The PDO smooth threads. So that's like a dissolvable suture. And we place it in the skin, and over 6 to 8 weeks it dissolves. But as it does, it's again created micro trauma in another plane of the skin. And it builds collagen and elastin around it. And it also acts as scaffolding for the collagen and elastin to build around. So it gives it a little bit more structure than me just creating micro trauma, than just sliding the needle in and pulling it out.
So when you do microneedling, from that one microneedling treatment, when do you see the best result afterwards? Because
So-
I think it takes longer than
It does.
right.
So people start to first see the results at like 21 days, 2 weeks, 21 days. And you notice your skin starting to become smoother, firmer, everything. Then at 3 months, the baby collagen is fully formed. And then 3 months after that, the baby collagen has now fully grown into adult collagen, and then your body will then start to burn it. So really, that's why we like doing the 3 treatments in a row, because from your very first treatment, that baby collagen isn't fully grown until 6 months. And so then by the time we got to your third treatment, 9 months, like you're for 9 months, you
Growing
are
new
looking,
collagen.
growing new collagen, and it's getting better every single day. So it's like, I'm giving you a gift that keeps going.
Everybody
That's what
likes
I'm
that.
concentrating on.
So, how many do you recommend to people? Like, what is the normal timeline for people, or do you have to do this all the time? Like, what? How does that work?
So we recommend that you do the 3 treatments every 6 to 8 weeks apart. And then after that, I see you, depending on your age and your skin quality and everything else, I may see you every 3 to 4 months, or I may see you once every 6 months.
Wow.
And then I recommend everybody get a laser at least once or twice a year.
And what kind of laser are we talking about?
That is going to greatly depend on the skin and what Stephanie's already done. I mean, I have lasers that are what I consider low level all the way up to, if there were surgery in the laser world, I can perform that, thinking about results that we get. So patients who have acne scarring and see Stephanie for their 3 sessions, they get a glow. They get introduced to a treatment that's tolerable but not painless, because lasers, again, are also going to not be painless. I'm obliterating skin. So once they've done that, Stephanie has a rapport with the patient. I can kind of come up with a treatment plan. Most patients, though, if I'm being very honest, halo is my most popular treatment. Most patients like to do halos because they can do less of those, and I can really get in there and do a lot of work with it.
I heard that hurts too.
If you aren't numb correctly, it can be very painful. Yeah.
I'm all about the pain.
Oh, yeah. I mean, and I have patients that use the products during their halo. But I will tell you 95% of my patients get through their halos just fine with just the topical numbing, because I numb my patients for an hour. So you get a significant amount of numbing.
Yeah, I did the Ultra Glow with Taylor, and it was so easy.
Yeah.
I
So
was
that's the lower level tier of it. But you don't need a halo. So that's what I would totally suggest for you. Now you're going to do
Never know.
microneedling. After
Yes.
your microneedling sessions, we
Yeah.
might talk about halo
Yeah.
if you wanted to do something that was more, once a year. If
Yeah.
you want something low maintenance, then for sure we can throw a halo at you and totally get rid of, any fine lines and wrinkles. We can help the appearance of pores. Get you anti-aging so that you don't have to do too much between. But looking at your skin, you have beautiful skin. Ultra is definitely what I would have told you first.
This is cut.
But I can see
but-
texture through makeup.
That's
so
true.
Still,
you have good
since
texture.
she had that laser,
That did
it
help a
made
lot.
such a difference.
Yeah. And it's been always, because I have olive skin, oily skin, Italian skin. It was broken out. I did Accutane. I did all those things. And then try this and do that. And then this. You're like, oh, my Lord.
Yeah.
It's never ending.
Yeah.
And which laser did you do?
Ultra Glow.
The Ultra Glow?
I loved it.
Did that
because-
hurt?
No, but Taylor's so sweet. I'm a big bedside manner person. Like, I can
She'll
do
be fine.
all things if somebody is very sweet to me.
Yeah.
You know what I mean? Like, if somebody's aggressive, I don't think I can handle it. But Taylor is so kind. He was like, "Are you doing okay? You'll be fine. How's it feeling?" Like, it was just, everything was so calm. And I didn't feel anything. I was like, this is so easy.
That is how it should be.
Yeah. It was like hot, like a little spicy, but
Yeah.
not bad.
I'm all about, does it hurt? Does it hurt?
Tell me what to expect here.
But I did tell Taylor one time, I did see someone, this was at Lemmon, who got like, I think it was a halo, and it was, they put these contacts in their eyes. It looked like
That is going to be additional resurfacing around the eyes. So they had intraocular shields in.
that looks terrible.
Yeah, that's for more mature skin or
Oh.
somebody who has terrible acne scarring or like really bad laxity under the eyes, but they
Yeah.
don't quite want a blepharoplasty yet or eye surgery.
Oh, okay.
And they're like, I just want more of a one and done, because we
Got
definitely
it.
have lower level answers for it that don't call for intraocular shields.
Got it.
But if I'm using an ablative wavelength and I'm going to get right up under your eye, I've got to put some
that looked crazy.
protection over your retinas. So
Looked like an
yeah.
alien. In
It's
there.
wild.
I was like,
You kinda look like
holy
a cyclops.
shit. That's crazy.
I mean, when you think about it, though, what an amazing time we live in
Oh, for
Yeah.
sure.
for
For sure.
this kind of stuff
Technology
to be
has
available.
come so far.
Yeah.
I love it.
and
I
are
mean,
you
that's
guys
unbelievable.
always learning new stuff? Is there new stuff constantly?
So fast, right?
Oh, yeah. Continuing education is huge, not even just as a nurse,
big.
but in
Yeah.
lasers especially, because there'll be a new laser on the market every, I'd say, 3 months minimum. And so a lot of it is just gimmick. Like, oh, it's the same wavelength that you may already have in your office, but look, this
Oh.
pretty machine, you know?
Mhm.
So that's why I think the continuing education is key, so you know how to call people's bullshit.
Right.
But also you know what you're offering to your patient and how is that the best. So, I mean, in the Laser Center, Taylor and I go to symposiums and we do preceptorships and lots of online things. And then even between the two of us, like, we learn so much from each other because we come from very different walks of life as far as lasers go. So I would say that, not to pat us on the back, but the Laser Center is pretty awesome at Lemmon. Yeah. Our
Yeah.
education and our experiences.
Sounds like it.
Pretty awesome.
You speak very eloquently about your career and your passion.
Thank
Yeah.
you. I love it. It's literally what drives me.
I mean, it has to be rewarding when you make people feel more beautiful.
That is
right?
why I'm in. I
Yeah.
mean, I came
Like, what
from
a rewarding
100%.
I came from infectious disease. So,
What?
working as a nurse in
Wow.
infectious disease, I've lost patients daily. And I worked in Seattle. So, the homeless population
Yep.
came to see us constantly.
Oh.
And I never got to know where someone went after we placed or pulled a PICC line or, gave someone the most serious antibiotic because they have the worst infection we've ever seen. Or,
Wow.
maybe they're a heroin user and they've got an infection and they've been getting high through their port and things like that. So I just got tired. And so I was like, I can't lose anybody. And I just want someone to come in and be happy.
Oh my God, no kidding.
Oh my
Yeah.
goodness.
Yeah.
So you both were in very kind of, that's like ER and then that. It's just very like
Yes.
stressful.
Yes, very much so. And
People
I
aren't
think
really that happy in this.
No, and I think that's why we love what we do so much
Yeah.
because we're able to, I say all the time, even to my patients, I'm so like, my patients will say, you're so cutthroat. I really am. I will tell you like it is 100% of the time.
Yep.
Sometimes that unsells what I'm trying to get you to do because I want you to have this realistic expectation. But at the same time, I tell my patients, like, I don't do brain surgery. Like, I'm here to make you feel good about your skin.
Yep.
I'm here to get you to a healthy place.
Yep.
This is not an emergent, urgent thing.
Yep.
So we're going to calm down and we're going to take this slow. And you're not going to be texting me at 2 a.m. about your issue. Like, it's not going to happen. So
Does that
I would
happen?
say, all
Yeah,
the time. It still
absolutely.
happens. Even when I tell patients, like, you're fine. It's okay. Like, I talk
They're
to you
just
at 9
nervous.
p.m., but 2 a.m. is fine too, I guess. But like I said, I just tell my patients, like, we're not doing brain surgery here. Like, this is for you to feel good. So this shouldn't be causing you an immense amount of stress.
anxiety.
And if it is, then we need to take a step back and evaluate what the game plan was and maybe come up with a different one for you.
Yeah.
Because I shouldn't be causing you any stress.
No.
No.
Yeah. 100%.
Oh, I like that.
Anti-stress.
So that's really
I do
cool.
too, but it means that you guys care.
Oh,
'cause some people are
absolutely.
not like that.
Yeah. I don't know how you can be in aesthetics though and not care. I mean, I've run into some people in the business that don't, but it doesn't really make sense to me because how do you, touch someone's face in the ways that we do and change their outward appearance, which affects their mental health, and then say
Confidence.
goodbye and not ever follow up and not
No.
try to make sure they're okay. It's wild to me.
Yeah.
And I think that all of us at Lemmon have a background in another area other than there's not anyone who like is fresh out and like aesthetics is the only thing they've done.
No.
Like even
Yeah.
Carrie, like she's a first assist super like she
Oh
does
my gosh. She's amazing.
everything. Like she could do
Yeah.
surgery if you needed her to. Like she's
Yeah.
so good at what she does. All of us have come from, like I said, like different walks of life. And so I think that it plays into our patient care and our bedside manner because we want our patients to be happy.
I think so too.
Yeah.
And it's very for me and I think her too. I don't know about Cruz, but it's very comforting to me knowing that you guys like know medical stuff in general.
Oh,
Because I'm
for
like,
sure.
what if I faint on this?
Yeah,
bed? Who's
that's a
gonna
very real
save me?
thing. Yeah.
It is. And people do.
Yeah, I was gonna say Botox is like the number one. Please have a seat.
No
I can
way.
see that you're flush.
People faint a lot.
Well, they get. I mean, I think people have only fainted
Just
maybe
lightheaded.
4 times since I've been at Lemmon. I've been there 3 years.
I've had 3.
Well, 3 of them were yours then.
Oh yeah.
I've
no,
had
I'm just
3.
kidding. I'm just kidding. But I'm not always in the hallway when when patients walk out. But
no, they do
Yeah.
it in my chair, and I'm like,
oh, there you go.
Yeah.
It happens.
It,
and
it
it's
happens.
normal.
But they
Yeah.
also tell me beforehand, hey, this has happened to me. I've
Oh,
only
they
had
just-
one that didn't warn me, and she goes, oh yeah, after when she came back, she was like, oh yeah, I forgot to tell you, and I was like,
That
It's
might have
okay.
been the first
But
thing.
you
I was
were
like-
totally calm when it happens.
Oh,
I'm
yeah.
assuming.
I mean,
yeah, there's
I've,
no surprise there.
I've seen it
and
happen
you can
so
see
many
the
times
signs before it happens. It's not like the
Yeah.
patient just sits on the
No,
floor.
no, no. You know,
Like,
you know
there's-
it's coming.
There are red flags.
Yeah.
No way. Like what?
And that's why we have
Yeah.
like ginger ale
Like
and
what?
crackers ready.
What?
I know that I had a patient go vasovagal in the chair. What was I doing?
What did you just say she did?
Vasovagal, meaning they
Vasovagal?
Yes.
they essentially they were holding their breath.
Yes. So, but you don't
Oh.
realize you're doing it. And
Right.
especially when something is painful or you anticipate pain coming,
Yes.
especially during lasers. It's really loud in the room and I talk he's like, this is what's going to happen. I
will
talk
not
the
have this
entire
happen.
time and this is what we're going to do. And I'm going to grab this handpiece and you're going to hear clicking. You're going to hear, me, messing around back here because you've got shields in your eyes and I have anxiety. So I know what that could be like thinking things are coming from all ways. But I know in lasers, typically when you're laying on the table, your hands are on your stomach or on your chest. And if I ever see someone's hands start to move to the side,
Yep.
then I know that
100%.
that's not them relaxing.
Nope.
Like you're not relaxing in a laser room. So I usually will say, hey, what did you do this weekend? Or what are you doing this weekend? Or do you have any plans? And then however their voice presents to me tells me, what's going on.
So
And then I just sit
interesting.
them up slowly and then I'll be like, okay, we're going to grab you, some water or some ginger ale or something like that. They come out of it very quickly.
Yeah.
though.
Yeah.
Yeah. I've literally only
Interesting.
seen one patient like hit the floor.
Oh, I've had no one hit the floor.
And it was when I very, very first started at Lemmon. And she had,
You're like, I'm leaving.
but it was amazing because everyone totally handled it like perfectly.
Yeah.
We used to have a check-in area where you had to come around a corner and come in the door to check in. And then there was another door before you could get back to your room. Well, where I sat when I would cover the front when I wasn't doing lasers, I couldn't see beyond that barrier. And she checked out with me and then went through the door, closed the door, but then I didn't see her on the other side. And I was like, where did she go? And then I got up and she was standing at the door, like holding onto the door. And then the minute she like let go of the door, she teetered. And then I like ran around. And luckily we didn't have anything in the way,
Oh, my goodness.
but she kind of like caught herself on the floor and she was like, oh my gosh, I just don't know what's happening. And I was like, you're fine. We're gonna,
very delayed
yes.
though.
Well,
Oh, wow.
and it turned out that during her appointment, she had like been freaking out the whole time. And
Yeah.
so it was like very,
Oh.
So
she
yeah, once the relief
hyperventilated and so then
starts
she
to flood your
calmed
body.
down and then your body's like, oh, okay, you need to have a seat. And she had a seat on the floor. So
I'm going to sit right here.
yeah, it was all very quick. Everybody handled it perfectly. Like nurses came running from all avenues. So
Oh, my
That's
goodness.
that's what I mean. It's so comforting. You
Yeah.
know, you're like in a place where if you do fall over,
Yeah.
everyone like
we've got you.
knows what to do.
Yeah,
Mhm.
you're in the best place.
Right.
So both of you are nurses, right?
Mm-hmm.
Stephanie is an RN.
Okay.
And I'm a practical nurse.
Okay.
Yes.
And y'all came from like more of traumatic kind of jobs into this.
Yes.
Do you feel that there is more money in this type of field than in the other medical field?
Right now, probably not. Because you can do travel nursing and get a ridiculous amount of money on a contract.
I've heard of
I've
this.
heard of this,
But
yeah.
that's just the time right now. Yeah, I think that the earning possibility, the potential is endless because if you put the work in, you make the money. You know, if you want to work 7 days a week, you work 7 days a week. If you want to work 3 days a week, you work 3 days a week. So, whereas with nursing, it's more like you get an hourly rate and then you could get a differential if you work overnights or things like that. But I didn't work, I worked in a specialty clinic. And so we were only open 9 to 5. So my earning possibility at the time was just literally the hours we had open, unless I wanted to cover ER and I absolutely never wanted to do that. So no, not for me. So I think that now I would say because of, the pandemic and things like that, you probably could make a stupid amount of money, but also like, I'm the kind of person that's like, what does that mean for your mental? You know, are you happy? Are you enjoying your life? Are you even getting to spend your money? Or like, are you racking in so much money because you're working 90-hour week, like paycheck? You know what I mean? Like, it's just not, that's not my thing. I also have kids. So like, I'm just not.
Yeah. The draw for me was the schedule and the hours and hours versus like stable pay.
Right.
Because in the hospital, I mean, I worked my, 3, 12, 13-hour shifts, sometimes 15, but then I would pick up every other week. And that was what I considered light. Like when I was paying for my wedding, I didn't want to put any on credit. And I worked 5 days a week, every single week. And like 13, 14-hour shifts. And that was night shift and it sucked.
Oh my gosh.
Yeah.
So I
just
mean,
like your
but
mental
again, like she
suffers.
said, the earning, like that's the wonderful thing about being a nurse is if you want to do that,
Yeah.
you can do that. You just go right there to the hospital and be like, yeah, I'm going to sign up for all this overtime.
And
They
then
take you.
even in aesthetics, you can, you can cert in different things. Like there are so many different, like Stephanie, congratulations, just got her CAN certification.
No.
Kyra just got hers. Oh, you haven't got, but you're going for it.
I will.
So again,
I will.
congratulations.
What is
Because
that?
you're going to have it. It doesn't matter. You're
What
going to
is
get it. You're a
that?
genius. Your CAN certification, once you've worked, is it 2 years?
I have to
under a
work 2
plastic
years. So I
surgeon?
haven't worked
Yeah.
2 years for Dr. Druber yet.
You can get certified. I don't know what it stands for.
Certified aesthetic nurse.
Specialist?
Specialty.
Okay, that thing. And so you get tested on all things injection, anatomy, laser, skincare. I won't say all things, but a lot of things in those categories. So it's another sort of test to your education and your drive because not every nurse is able to get that. Stephanie's brilliant though, so she's gonna get it. But all of our injectors are they're all CAN certified now.
Yeah. So if somebody does not live in Dallas, like what is some things that people should look for? Like, can you have like people do wrong things with microneedling or
Oh, yes.
like what would
Tell
those
us.
be? Like something to look
Um,
out for, questions to ask. Like, because if you don't know and then you have this like botched face, it's kind of scary.
So I guess, I mean,
With microneedling, I think, and it's really interesting. We just did a consult with a patient yesterday, and like had this talk. I think with microneedling, it's going to be about patient qualification.
Yeah. Okay.
There are absolutely people who are not candidates for microneedling. If I did not work with Stephanie, I would not have gotten microneedling. I am not a candidate for microneedling.
Oh.
I hyperpigment terribly easily.
Okay.
And so I think that if you have someone like Stephanie who's willing to pull another provider in to share those experiences or to share that expertise with you, we'll be very honest. I've said to patients that she's consulting with, here are the risks.
Yep.
You can deal with hyperpigmentation all over your face or centrally located or just on one area. We can't tell you where it's going to happen, when it's going to happen, how bad it's going to be. Your texture will be beautiful, though. She's absolutely going to get rid of your texture. But you run the risk of that pigment. And for some people, me included, that's why I did it. I was willing to take the risk because I also know how to pull hyperpigmentation out. 'Cause that's what I do all day.
Right.
So if you keloid terribly,
Yeah,
you're absolutely not a candidate.
What is that?
What is that?
An eye keloid.
What is-
It is an abnormal formation of scar tissue. So if you look like right here under my chin, I don't know if you can see it because I have makeup on, but I have a keloid right here from a surgical scar. And so
Oh.
anytime I'm cut or fall or anything, I get raised scarring on my skin. And then I have to treat it with laser to pull it out. Or now I have Steph. She could attempt to microneedle it. But those would be my biggest things, I would say. Also, if a patient's not going to follow through with their aftercare, to me, they're not a candidate for
they're
anything.
not a candidate.
So
They're not a candidate.
And what's
for
that?
anything.
What is aftercare?
Aftercare, it's very specific for the
You-
procedure.
yeah, you have to
Yeah.
use specific products that we give you. And by aftercare, when it comes to traumatizing your epidermis like microneedling does, your aftercare goes far beyond just healing. So it has to be someone that if Steph says you need 3, you've got to commit to the 3. Because
Oh,
what'll
I see
happen
what you're
is you'll
saying.
do 1 and then you'll go, well, this didn't do anything.
Right.
And now you're questioning Stephanie's expertise. And it's like, well, she told you needed 3. Like, I don't know what you quite expected out of 1. You've got to think about it like, if you've got a face full of acne scars and you've done Accutane and you've done, different meds from the derm and you've tried all these topicals and nothing's been working for you, it didn't take you one night to get the acne scar.
Of course.
right.
So
Yeah.
we can't in one session essentially remove that,
It's like the quick fix people.
Oh, for sure.
It's like the
Oh.
people who go to the gym and diet for one
Oh,
day.
yeah.
And they're like, oh, I don't have
They
six
take their
pack.
selfie and they're like, that was it.
Yeah.
Exactly. And especially for like heavy acne scarring, like I've told some people we might need 5 to 7 treatments.
Yeah.
And after 3, they're like, well, it's a little smoother, but I'm not getting that yours. And I'm like, oh, honey, this ain't 5 to 7 treatments.
Yeah.
We're nowhere
I'm
near
like,
where-
I'm
down
like,
here.
you've realized like this is over years
Yeah.
of microneedling. And and I've been very consistently microneedling my face, every 3 to 6 months for 4 or 5 years now. That's a lot.
That's a lot.
That's a lot.
And
So,
I'm in your skincare routine.
and my skincare routine.